So I have had a number of patients ask me why I think pelleting is the best form of hormone replacement treatment. And if you look at how hormones can be replaced, there are standards such as topicals, transdermal delivery systems. So patches are common. There's also compounded bioidentical hormones in the form of creams. And when you look at these products, anything that is placed on skin is designed to be a barrier, to not absorb. So these vehicles are circumventing that system. Patches are use adhesives, and adhesives cause irritation to the skin. They are physically visible and they leave adhesive marks. Both the topical and the transdermal patches are also things that you have to be careful with. The topicals more so than the transdermals, because if you are skin to skin with someone, they will also get exposure to that hormone. So, especially males, for example, with something like androgel, if it's on their hands, touching their children, if it's on the skin that is exposed, you don't want your spouse or your children getting exposed to the androgels. What I find is that it's also more difficult to really get high levels in the body with the topical treatments. I think they can make nice symptomatic relief, but I think to get truly high therapeutic levels of these things, just inadequate. Oral forms of hormones are limited, and so the problem with oral hormones is anything that you put in your mouth is metabolized by the liver, and so what is placed in your mouth is not always what makes it to the end organs. And so that was actually the problem with synthetic hormones, specifically the progestins. And so they were used in the 60s and 70s. We saw a 7% bump in breast and uterine cancer with those. The last vehicle, specifically for testosterone, is intramuscular injections. And so one of the things that we see with that is, one, it's painful. Two, when we put hormones into the muscle has great blood supply. And so what you get is rapid absorption and then rapid degradation, right? So in order to really keep hormone levels relatively even, it has to be done at least twice a week. And so that becomes cumbersome and painful. The pelleting system, although not exactly physiologic, in my opinion, is as close as we can get at the moment. Basically, what you're doing is you're putting a pellet under the surface of the skin where it's exposed to the blood supply. And so there is a continuous absorption of those pellets. And then if you were to, say, do a spin class or go for a run or really exert yourself and increase your cardiac output, now what you're going to have is more blood delivery and more absorption. So you will have a baseline steady state and then a peak with physical demand, right? So again, behaving as a much more physiologic way of getting a delivery system. Also, when the pellets are in the subcutaneous space, it's directly into the bloodstream and it goes directly to the organs. It bypasses the GI tract. It is not metabolized, and so what you place under the surface of the skin is what is delivered to your end organs, which is exactly what you want.